Now, live, CBS 3 Eyewitness News at...
Now, our health alert tonight, it is World Diabetes Day to raise awareness about a disease that has really been skyrocketing.
Medical reporter Stephanie Stahl has one local woman's frightening struggle with diabetes as the city turns blue to mark the day.
16 buildings in Philadelphia are lit up in blue, but you can't see many tonight. It's to raise awareness for diabetes, with over 1 million new cases being diagnosed every year. And if not properly treated, it can cause devastating problems. 33-year-old Shoshana Garfinkel's vision began failing during her first pregnancy. She was blind by the time her daughter was born.
I couldn't see at all. I was completely blind.
Shoshana was diagnosed with diabetes as a child, but she wasn't taking care of herself and consequently lost her vision.
The entire eye can now fill with blood, so I can't see in and the patient can't see out.
She had macular edema, where blood clots in the eye and blocks a patient's vision. After Shoshana's daughter was born, Dr. Leonard Ginsburg at Moore Eye Institute operated on one eye. When Shoshana came in the day after surgery, they were both in for a surprise.
I was like, Dr. Ginsburg, I can see your face.
She was able to now see out of both, yet I only operated on the right eye.
On this World Diabetes Day, they want to get the word out about the importance of being diagnosed and properly managing the disease.
And just to see my daughter's faces, their beauty, it's a miracle.
Today, Shoshana has 20/20 vision, but she even has more clarity about her health.
Only now that I had a child am I going to the doctor, following up with the doctor, keeping the appointments and listening to them.
We have more information on diabetes, including symptoms and treatments at CBS3.com. Click on Health. I'm Stephanie Stahl, CBS 3 Eyewitness News.
For Shoshana Garfinkel, the little things mean a lot, like being able to see her daughter Emma's smile. 5 years ago, that didn't seem possible. When she was pregnant with Emma, the diabetes she battled since childhood began to steal her sight.
All of a sudden, I saw a smear, like it looked like a spider crawling.
Tiny blood vessels in her eye had begun to bleed, turning her vision from this to this. The condition is called diabetic retinopathy. It's common for diabetics and can be sped up by pregnancy. Dr. Leonard Ginsburg of the Moore Eye Institute sealed off some vessels by laser, but it wasn't enough. By the time Shoshana gave birth, she could barely see.
I couldn't take care of a newborn. I couldn't take care of my baby. I couldn't even see her when she was born.
And even though her eyesight did start to improve later, she still needed surgery. Dr. Ginsburg started with the right eye.
We then put a needle here, here, and here, and go into this chamber and take out all the jelly, and then put brand new clear water in.
A day later, the right eye was clear, but so was the left.
I could see out of both eyes very clearly. It was a miracle.
I just started to lose it. I cried. Shoshana started to cry.
Dr. Ginsburg says he has seen this condition clear on its own, but never this quickly. Now, her left eye did worsen again, though, and eventually Shoshana had to have surgery. But Dr. Ginsburg says what happened originally with her made him rethink his role in medicine and the role he says a higher power may have.
Now I'm more excited about being a doctor ever before because I realize I'm not alone, and that's neat.
Shoshana has had near 20/20 vision since that second surgery. She says even years later, she doesn't take anything for granted. Allie Gorman, Channel 6, Action News.